November is Pancreatic Cancer Month, and actually November 18th is Pancreatic Cancer Day. And I'm pleased to present this proclamation, and we have some guests with us today from the Pancreatic Cancer Action Network, or PanCAN. And I see them with us now, and we'll get to them shortly. Their vision is to create a world in which all patients with pancreatic cancer can thrive. And unfortunately, every day, more than 1,200 people worldwide will be diagnosed with pancreatic cancer. And it's sometimes called, if you've known anyone who's had it, it's really operates this way as a silent disease because the symptoms aren't really noticeable in its early stages, and they're very easy to ignore and can be vague. And even though overall death rates to cancer are declining, death rates for pancreatic cancer are increasing. So early detection becomes very important for all cancers, but particularly pancreatic cancer. The incidence of pancreatic cancer in African Americans also is 50 to 90% higher than in other racial groups. And African Americans, unfortunately, have some of the worst prognosis, and the survival rates have not increased. And so it's one of the really important missions of PanCAN and those who are trying to increase awareness in early detection and treatment. We have to fight this disease, and we have to support it as we search for a cure, the funding and the research. And so I wanted to bring and allow for a couple of minutes introduce our guests, Ms. Treva Wright, who is with us, who is the outreach chair of the Pancreatic Action Network, Ms. Maggie Walsh, who's the senior community relations manager for the Pancreatic Action Network. And I think we also have Mr. Robert Williams. Yes, I see him there as well. So I want to turn it over to you all for just any brief comments you want to make about the proclamation, and then we'll read the proclamation. Ms. Wright, Dr. Wright.
Good morning. My name is Dr. Treva Wright. I am a Montgomery County resident and business owner, and currently the outreach chair for the PanCAN DC affiliate. I would like to thank Councilman Jawando and his wonderful team for giving us this space today to spotlight World Pancreatic Cancer Day and November Awareness Month. My own story is that I lost both of my parents to this terrible disease in 2019 and 2020. I have joined PanCAN as a volunteer and outreach chair in a mission to take bold action to improve the lives of those affected by pancreatic cancer by advancing research, building community knowledge, and advocating for patients. As Councilman Jawando said, pancreatic cancer is the third leading cause of cancer-related deaths and the world's toughest cancer, with a 5-year survival rate. Again, thank you for this space. And if you know someone who is affected by this disease and would like resources, feel free to contact myself, Robert, or Maggie, who have also joined me today. Thank you.
Thank you very much, Dr. Wright. Maggie, would you like to add anything?
Absolutely. Thank you, Councilman Jawando, and thank you, Treva and Robert, for joining us today. We're so grateful to have this space to spread awareness, as you both shared, for such a critical disease, and for a disease with a low survival rate as pancreatic cancer that has so few treatment options. As you touched on, Councilman Jawando, research is key to improving patient outcomes. So we just want everyone in the community to know that PanCAN is here as a resource for you all. If anyone you know needs support, please contact PanCAN's patient services for free personalized resources and hope. We are here and available to you, and the phone number is 877-2PANCAN. And we also invite the community to join us this Thursday, November 18th, which is World Pancreatic Cancer Day, to join us in wearing purple. You can post on social media. And if you're interested in walking with us locally to end pancreatic cancer, please save the date for April 30th, 2022, which is our PanCAN Purple Stride, Maryland, as well as Washington, D.C., where you can walk to honor and remember your loved ones and help us to continue to improve patient outcomes by raising those critical funds. So thank you so much for having us.
Thank you. That was important information, and I'll definitely be modeling and posting and walking next year. Mr. Williams.
I believe that Maggie and Dr. Wright have covered most of the major points that I think we should discuss. Again, we are here. Thank you so much for giving us this platform to talk about this very important issue today. with that, I will turn it back to you. Thank you.
Sounds good. Thank you. I'll read the proclamation here, which we will get to you in actual physical form as well. And we'll make sure you have it. And this is from the entire county council, Montgomery County Council. Whereas pancreatic cancer is the 11th most common cancer in the United States and kills more than an estimated 48,000 people each year. This represents about 7% of all cancer deaths in our country. And whereas in the United States, there will be more than 60,000 diagnosed cases of pancreatic cancer in 2021, with the 5-year survival rate being just 10%, pancreatic cancer will impact an estimated 1 in 64 people in their lifetimes. And whereas, despite there being no direct cause of pancreatic cancer, there are certain risk factors that can increase the likelihood of an individual developing pancreatic cancer. Those who suffer from long-standing diabetes, obesity, chronic and hereditary pancreatitis, habitual smokers, and those with a family history are more likely to develop pancreatic cancer. And whereas, according to the Pancreatic Cancer Action Network, African Americans and individuals of Jewish descent are more likely to develop pancreatic cancer than any other racial and ethnic group. And those over the age of 60 are also at higher risk of being diagnosed with pancreatic cancer, with the average diagnosis age being 71 years. And whereas, if you or a family member are at high risk for the disease, it is important to know the symptoms and to speak to your doctor immediately if any occur. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby recognizes November 18th as World Pancreatic Cancer Day. And be it further resolved that the County Council encourages all residents of Montgomery County, especially those ages 60 and over, to talk to their physicians about prevention of this disease. And it's presented on the 16th of November today in the year 2021, signed by myself and our council president, Tom Hucker, on behalf of the entire council. And really want to thank you, Dr. Wright, Mr. Williams, and Ms. Walsh for your work. And I know the council shares those sentiments, as I know our council president does as well. So really appreciate you being here today. Council President, I turn it back to you.
Sure. Thank you so much, Councilmember Jawando and Dr. Wright. I'm sorry for your losses. I lost my own dad to pancreatic cancer in November on Veterans Day in 1987. And so I'm very grateful to you and all of our guests for your work. And again, to Councilmember Jawando for raising awareness about this very important day.